Thank you, sir. So today I'm talking on ocular manifestations of stress, and I thank our audience and our expert panel for being here across lunchtime. So it is really inspiring me to do a good job at this. So there is a lot of interest in stress in the general community, but I think us as physicians and as clinical personnel, we are not as tuned to it as we should probably be. And what is stress? So stress is basically our body's reaction to a challenge or demand. And in short bursts, it's very good because it helps us fight when we need to, like avoid danger or meet a deadline. But when it is chronic, it is a problem for us. And we've always thought that people are stressed because of their disease or because of their eye condition. But we also need to warm up to the fact that stress itself may be a causal factor of many eye diseases. So we have two basic responses to stress. One is the sympathetomedullary pathway, and the other one is the hypothalamic pituitary adrenal axis. Now the SAM pathway is basically an immediate response to stress, and it's a fight or flight response, whereas the HPA axis is a more slower response to stress, and it has a very high influence on the immune system as well. So like I mentioned, the SAM is an adaptive system for a flight or flight response. It has a very significant impact on something called Flamer syndrome, which we will come to in a while. And it's important for us because chronic stress can lead to chronic adrenaline release, and it can lead to consistently dilated pupils. And now as cataract and refractive surgeons, we know how important the pupil is to us in our patient outcome. So stress and its management is also very important. The HPA axis acts via glucocorticoids or cortisol, and this is a slower pathway. But the important point to note here is that chronic exposure to glucocorticoids can eventually be toxic to neural tissue and in turn retinal tissue. The ANS system, we know, is a delicate balance between the sympathetic and parasympathetic system. So if this balance is lost, then it takes a role on auto-regulation of our vasculature. And we know that a lot of diseases are precipitated by vascular dysregulation. An important thing to note is the prefrontal cortex shows atrophy in conditions of chronic stress, while the amygdala volume increases. Now, the amygdala volume enlargement is also found in patients with glaucoma, so we can conclude that there is probably a direct or indirect relationship between the two. In glaucoma, stress can precipitate raised intraocular pressure. It can cause vascular dysregulation. It can cause an imbalance of autonomic nervous system and immune aspects as well. I'm going to skip how it influences both normal tension glaucoma and high tension glaucoma. But basically, it works both in some way of vascular dysregulation. We know that stress can definitely increase inflammation by increasing the TNF alpha and IL-6 factors, and they may also have a role in glaucoma along with having a role in inflammation. So Flamer syndrome was discussed or described by Dr. Joseph Flamer from Switzerland. So here he has described a personality type where patients have cold extremities, low blood pressure, increased pain sensitivity, probably a perfectionist or a type A personality. And they have found ocular associations with these patients with normal tension glaucoma, retinitis pigmentosa, retinal vein occlusion, preoperative ischemic optic neuropathy, along with some ear disorders and multiple sclerosis as well. Apart from malingering, there is something called non-organic visual loss as well, which is not perfectly explained by our ocular findings, and this may be precipitated by stress as well. Other ocular associations of stress would be AMD, retinitis pigmentosa, and myopia, both in precipitating it and in influencing how the patient handles once the disease has set in. We all know about dry eye syndrome, how there are so many studies that have been done on how dry eye patients are stressed, but lesser so on how stress is precipitating dry eye. And we know that the autonomic nervous system can affect the secretion of tears, saliva, and other body fluids. So this can be an important factor in influencing the precipitation or increase in dry eye as well. And how are we going to manage this? Now, obviously, if it is stress that is precipitating some disorders, then the management is to reduce stress. Relaxation, psychotherapy, is a very important factor, and a lot of studies have been done on intraocular pressure and stress, and it shows that certain ways of reducing stress can in turn reduce the IOP as well. I'm not going to go into the details of meditation, but that is something we must all explore. Things like music therapy, biofeedback therapy, autogenic training, these are all ways of handling stress. But what about us? Do we need management of stress? Are we managing our stress well? I think it's very important for us as doctors to be very careful of our health and our stress and our mental capacity, because we can't pour from an empty cup. So it's very important for us to be well balanced, to be able to take care of our patients. So we must also make sure we do some meditation and exercise. We must keep our close circle of friends active so that we are able to talk to someone when we need that help. So thank you. I think we wound up pretty much in good time. Yes. And if there are any questions, I would be glad to take it off the podium so we can free the stage for the next session. Thank you.